So this is part 3 of our discussion about the gastrointestinal physiology. So let's begin with the stomach. So your stomach is this organ that connects your esophagus to your duodenum. So it is bordered above by your lower esophageal sphincter, also known as your cardiac sphincter. Okay, this is because it is located at the part of the stomach known as the cardia. So the cardia is surrounding the opening of the esophagus into the stomach. Again, that's cardiac or lower esophageal sphincter, or shortly, your LES. Other parts of your stomach include your fundus, which is a rounded portion of the stomach. Then you have the body, which is the internal or the biggest portion of your stomach. Then you have your pylorus here at the bottom, containing your pyloric sphincter, which is the border between the entry from the stomach to your duodenum, or the first part of your small intestine. So may duwa ka sphincter kay stomach above and below, from the esophagus and to your duodenum. You also have your lesser curvature, which is the small curve found at the innermost section of your stomach, and then you have your greater curvature. And as you can see, your stomach also contains those many layers I've talked to you about, and then it also contains lots of muscles, which will be responsible for the mechanical digestion of the stomach. Right? So next, let's proceed. You have the functions of the stomach. Number 1 is for storage of food. Your stomach can actually hold up to 1.5 liters of food if it is completely relaxed, right? And then for formation of chyme, what is chyme? This is just your bolus plus the gastric acids in your stomach. So it will dissolve the solid bolus into a liquid chyme. Next, control rate of gastric emptying. Why is this important? Because if your stomach gives food to your small intestine too fast, then absorption can happen at a lesser rate kay small intestine. So it's important na ginaamat-amat lang hatag, or that your stomach slowly gives out or slowly excretes the chyme towards your duodenum para or for ideal or maximum absorption kay small intestine. Again, it's important to control the rate of gastric emptying. Next, secretion of gastric juice, of course, for digestion, secretion of gastrin, which is a hormone, into the blood to help with the digestion. So kay stomach, we have mechanical digestion due to the muscular contractions. Then you have chemical digestion as well due to the enzymes present inside your stomach. Next, you have the following gastric glands of the stomach. So kay stomach, gali may arta ginatawag nga gastric glands, able to release various enzymes and substances which contribute to the formation of gastric juice. The normal gastric juice produced is 2,000 to 3,000 ml per day. And you have what you call a gastric pit. So see, gastric pit, this contains all the glands of the stomach, including mucous cells, parietal cells, chief cells, and G cells. So what happens is that each of them secrete substances within the gastric pit, that eventually make their way into your stomach or into the opening of your stomach. So number 1 gland, you have your parietal or oxyntic cells. They release intrinsic factor, which is important for the absorption of vitamin B12. Na kung wala ka gani intrinsic factor, which is releasing important for vitamin B12 absorption, you get a condition known as pernicious anemia. Pernicious anemia. So this is where red blood cells, which need vitamin B12 to develop, do not get that nutrition that they need. So you get pernicious anemia. Next, so the parietal cells, they secrete hydrochloric acid. Then you have your chief or peptic cells releasing pepsinogen, which is actually an inactive form. So see, pepsinogen is inactive not until it makes contact with the hydrochloric acid, then it becomes activated, and pepsinogen becomes active and is now called as your pepsin. Right? Pepsinogen inactive, pepsin ang active form, but it needs to make contact with HCl. So that's why it's known as your peptic cells. Next, you have your mucous neck glands secreting mucus, which also protect the lining of your stomach. And lastly, you have your pyloric glands containing G cells able to secrete gastrin, which is a hormone. So si gastrin niya is sent into the blood, tapos nalibot siya sa circulation until eventually it goes back to your gastric pit to help with the secretions. For the conditions, you have here GERD, which is actually a weakness or due to a weakness of your lower esophageal or cardiac sphincter. So gastroesophageal reflux disease is what GERD means. And take a look at this one here, right? So hina si lower esophageal sphincter, it cannot close properly, allowing the acid inside your stomach to go upwards and to go back sa inyong esophagus, which is not healthy. So usually, high risk for GERD ang obese people because it can alter the motility inside your esophagus. It increases thoracic pressure, and it might cause the weakness na of your lower esophageal sphincter. Right? So, mga pinaka-cause weakness ni lower esophageal sphincter. So, symptoms include tooth decay, chronic cough, abdominal bloating, belching. Belching is tig-ab, right? You also have hoarseness of your throat, laryngitis, lump in throat, laban throat symptoms because of course the acid is now getting into the esophagus. Hindi siya anad nga may acid na da. So lifestyle changes are given or advised to the patient. So to stop smoking, to manage the weight, enjoy smaller, more frequent meals, allowing the stomach to have time to give the food to the duodenum or to control the rate of gastric emptying properly. So wear loose clothing and sleep with head and shoulders elevated. So to help with para hindi na mag-backflow ang inyong acid, right? So that is GERD. Next, you have your pancreas. Your pancreas is both an endocrine and an exocrine gland, as discussed during our Q&A. It is able to secrete pancreatic juice, which is one of its exocrine functions, 1,200 to 1,500 ml a day ang nila gina-release, and it is alkaline. So as you can see here above, ito important passageways from the pancreas. So si pancreas, meron siya cells that paproduce sila sang inyong pancreatic juice. It will have to pass through your pancreatic duct or your duct of Wirsong first, which eventually will head out and empty into your accessory duct or duct of Santorini and your hepatopancreatic ampulla or ampulla of Vater into your duodenum. The main function of your pancreatic juice, since it is alkaline in nature, is to battle the acidic chyme or i-buffer niya si acidic chyme going in through your duodenum. So this is your pancreatic juice. It's clear, colorless, consists of waters and bicarbonates and a lot of enzymes. So are important? You have your pancreatic amylase, digesting starch, carbohydrates, and glycogen. You have your trypsinogen, chymotrypsin, carboxypeptidase, and elastase to digest proteins. And you have your pancreatic lipase to digest triglycerides, fatty acids, and monoglycerides. So this is your pancreatic juice. Your stomach adds acidic chyme. Your pancreas releases pancreatic juice into your duodenum, which is alkalinic. Para i-battle or iibanan niya si acidic chyme. Because if chyme just gets secreted in its acidic, very acidic nature into your duodenum, ma-injure si duodenum. Next, you have your liver. Your liver is the heaviest gland in your body and the second largest organ as well. It is very important because it performs a lot of functions. But before that, let's talk about its blood supply. So for its blood supply, it receives oxygenated blood from your hepatic artery and as well as deoxygenated but nutrient-rich blood from your hepatic portal vein. So ang importance ni oxygenated blood, of course, is to supply your liver with the oxygen it needs. However, the nutrient-rich deoxygenated blood is also passing through your liver in order to get detoxified and to get processed. Okay, so from these two vessels, it goes into your hepatic sinusoid, central vein, hepatic vein, back to your inferior vena cava, and eventually back to your heart. So for the next part of our discussion, we'll get to talk about the functions of the liver and all the remaining other organs. Thank you for listening.